Welcome to Physicians Keepers, where we as a physician community tackle the challenges that are unique to us by creating awareness and finding solutions from our experiences. We also learn to look out for our fellow physicians to ensure that no one is left behind. I am your host, Dr. Ali. Stay tuned and enjoy the episode. Hello and welcome to another episode of Physicians Keepers. I am your host, Dr. Ali, and I'm really excited to have you all here today. And today I have with me Dr. D, is what I would stick with, and she would introduce herself and share her story. But in this series, we're talking about bullying that occurs in medical training, and we are talking to physicians who have had firsthand experience with this. Just hearing their stories, just kind of seeing what they had to go through, how they are healing their journey through that, and also talking about solutions to this silent pink elephant in the room that a lot of people do not want to, or do not even think happens in the physician community. So Dr. D, could you please introduce yourself to the audience?
Absolutely. Thank you, Dr. Ali, for having me on your show. My name is Dr. Degha Fongod. I am an internal medicine physician who abandoned internal medicine. And I currently practice aesthetic medicine in the DC metro area. And like Dr. Ali said, I did go through some bullying during my training, which I'm going to be talking about today. Where do I start? Okay, so basically it started with intern year.
Yeah, which is typically where it starts. Yeah.
Actually, let me take it back. Before intern year, I hadn't experienced bullying, but I had seen someone get bullied.
Yeah.
So I went to where I did my training. I will not say where, but I did my training somewhere in Connecticut.
Yeah.
And prior to getting residency in that area, I actually did my internal medicine rotation there.
Yeah.
So I knew they knew me and everything. And the first time that I saw bullying, but I didn't recognize what it was during my second month of internal medicine. I was working with an intern.
Yeah.
And she was with a second year resident. And wow, she was terrible. She was terrible to the intern. Because the intern, there was a little bit of a language barrier and they had an accent.
Yeah.
And so, I mean, when I talk about bullying, I'm talking yelling in front of nurses. I'm talking, like nurses, like at a nursing station. And just like really like bad belittling to the point where like almost every week she was crying,
Wow.
Yeah, it was terrible. And so but when she was talking to me, she would be like very nice, very fake nice. And, because I'm the student. So yeah, I'm supposed to see the positive side, I guess, right? But I mean, so I had some idea that this was happening, but I figured it was, it had to do with just that person. And so
you did not think it could happen to you?
No, when you're going into residency, like I was the only Black person in my whole class. So I figured that there would be some form of racism.
Yeah.
I was mentally prepared for that.
Yeah.
But that is not what I experienced. Now, I will say that if you're in academia in the Northeast, I think that the racism is very subtle.
Yeah.
I like racism in the South because I've been in the South. And they tell me straight up, like, you're Black, I'm not seeing you. I love it. It's very straight and I can understand it. But I didn't understand what was happening because everybody was so nice on the front end.
Yeah, yeah.
Right? But then in the back, like the sneaky things that they would do, and there was just so many things. So I didn't know what I was getting myself into.
Yeah.
But first year, my second month on floors, I was with this resident.
Yeah.
We'll call her K for now, like K. And again, same issue.
Yeah.
There was a language barrier because the place where I did my residency, it did have a lot of international students. So a lot of people came from different countries. So there was a language barrier, there was a cultural barrier. So I figured that like the way that this person was behaving was probably related to that.
Yeah.
But it was bad. It was such a bad experience. This person, so I was his first year and they were a second year. And it was almost like they expected me to do everything and be aware of what I needed to do. Intern year.
Yeah.
I don't know.
Yeah.
Like the most I know how to do is like do an HPI. I mean, I'll follow up on labs and everything, but like I cannot make critical decisions, at least not in this was 3 months in. So like I was still not ready to be able to make those types of decisions. But what happened was my resident would literally leave everything to me.
Yeah.
Like everything. So I had to come up with plans and everything. And then whatever I said, she would just copy it and like use it for presentations, right? With the attending. And I'm just like, what is going on? And so if something went wrong because I made the wrong decision, I would get into trouble for it. I would get belittled. I would get reported. And like, it just kept happening like every single week. I was just like, what is this? And like, again, same thing that happened with the other girl. Like I was belittled in front of nurses, even in front of patients. Like patients would be like, oh, you know how like we see each other like, and they'll be like, okay, you'll be okay. Like,
yeah.
People knew that I was being treated bad. Even the janitors knew about it. Like, word went around like this girl is not being treated right. And so she would belittle me. She was very negligent with patients. And whenever something happened, she would blame me. And so we ended up having not really like a bad outcome, but like a very dangerous outcome that came about. And this is something that happened when I had already gone home. And again, I got blamed for it. My attending never asked me what happened or what my position was. And everything was on like based on what she said. And I'm like, she's the problem. She's not doing things in a safe way. And I don't have the knowledge
to do things right.
To do things right. Yeah. And it turns out the problem was she also didn't have the knowledge, right? And so that is what happened. It was kind of the blind leading the blind. And then an attending who believed her and didn't really check everything together, like all what the team was doing. And so, we had a lot of episodes yelling, screaming, like it got to a certain point. I like broke down in tears and I was like, I can't do this anymore. You can't talk to me like this. I'm a human being, right? Like you can't treat people the way you're treating people. And I was like, listen, if you keep doing this, I'm going to tell somebody, right? And so at that point, she was very apologetic and she started talking about how it was a cultural thing. Let's put it this way. She's like from an Asian country. So it was like a cultural thing. She felt like that was how she was treated by authorities. So she felt like that's how she should have treated me. And why? Like that really didn't make any sense. So
if it made you feel bad, then why would you want to make another person feel bad?
People have issues. And one of the things that I've had to learn or looking back is that people come into medicine with all sorts of problems and all sorts of baggage. And you're not immune to that when you deal with them, right? And so, unfortunately, I had to deal not just with the baggage that she was not competent enough at that point. I also had to deal with her psychological baggage, and it turns out she was having marital problems and she was taking it out on me, right? Like all of her stuff.
And so it's funny you would say that, because that's another, in when we're looking at bullying, another thing that can happen is displacement, right? Where you're not the actual target, but they cannot take it out on the individual.
Right.
But then from a power standpoint, they can take it out on you. Because you are less of an authority to them.
Exactly. And it was really bad. So that was the beginning of problems that I had during residency. So I ended up failing that month because of it.
Oh, wow.
So I failed that month, and then it put me into like a trajectory of, everybody's looking at you. Are you going to need remediation? Are you going to,
Go on probation.
forward?
Yeah.
Right. And so I ended up I was on probation for 2 months, and then I had to I got out of that because I was able to perform well and everything. But there was just a lot going on that year for me because that was the first part. And then a couple of months later, I was in a car accident, and my my chief resident refused to give me time off. That was tough. And so then I had like a cumulative effect. So I was dealing with this, then I get a car accident, and it was pretty bad. Like my car was totaled.
Yeah.
And for him, because how with chief residents, people are always taking off, and you're like, oh, I'm not feeling well, I want to take off. And they're just like, no, you just can't do that. And so I don't know what he was thinking. I think he thought this car accident wasn't serious enough. So he literally was like, no, you can't have time off. And you're going to show up to work every single day because that's what you're supposed to do. So yeah, I had to show up. I was in so much pain. I didn't have physical therapy. And it wasn't until 2 weeks later that he actually discovered what happened, that one of the residents was the one who was driving me to school, to the hospital every day. And so he was like, well, why are you driving her? And then that's when he actually found out. He was like, oh my God, I didn't realize it was a bad accident, And so it came up because he tried to apologize. I wasn't having it. And I brought it up to my program director.
Yeah.
And my program director said I should have stood up for myself.
Yeah.
And I think that is the thing that I learned. Because I'm like this, I grew up in Africa and I'm in this country. I've always learned to just, keep my head down, work twice as hard, do what you got to do. And, don't bother anybody. And hopefully nobody will bother you.
Yeah. Yeah.
And then now I'm in this situation where I pretty much did that and it was counting against me. Right?
Yeah.
And so, yeah, my program director was like, no, it's your fault. You didn't say anything when all of these things were happening. So we're just going to believe what they said. So I think one of the key takeaways is that you have to stand up for yourself. Now, do it be safe about it.
In a respectful way. Yeah.
In a respectful way, because, if you go about it the wrong way, you can get kicked out of a program, which, that will just not be that would be a terrible position to be in.
Absolutely.
But yes, I experienced a little bit of stuff. Interestingly enough, my second year, that resident got into a lot of trouble because there was a bad outcome when she was a third year.
So this time they found out her deficiencies.
Exactly. So now everybody's apologizing to me. They're like, oh my God, we didn't realize. Oh my God, I'm so sorry. We didn't believe you.
Yeah.
Yeah. But I mean, it was already too late. We're talking about a bad outcome that ended up costing someone's life.
Oh, wow.
So yeah, it was a pretty bad situation, but it did not erase the trauma that I had already gone throughout my whole first year, because the attendings were they had these preconceived notions about me based on one experience.
Yeah.
Right?
Yeah.
And so it was almost like every time I would go on the floor or whatever rotation I was on,
they're expecting you to build.
Exactly. And it was like I was starting from minus 20, can I start at 0? I didn't get that. And so it just messed with my head, and it wasn't just that happened first year, and I ended up, having 2 months probation. And then so I started later than everybody else. That in itself, it's its own thing.
Yeah.
And then just trying to go through the motions, knowing that people had these notions about me. And it wasn't until towards the end of second year that people started to say, okay,
she actually knows stuff.
She knows stuff, right? And then I remember third year I had one of my attendings was he gave me really good review. I got third year was amazing for me. And one of my attendings was I'm so happy I didn't listen to what other people were saying about you.
Yeah. Yeah.
And he literally was I don't care what anyone says, I'm gonna give her a chance and get blank slate. And a lot of professors ended up apologizing to me because they were not nice to me from the get-go. They had judged me based on wrong information.
Sure.
But it didn't matter, right? The damage was done. Like, I had gone through almost 2 years of like kind of walking on eggshells.
Yeah.
Because yeah. So it was a tough situation.
So kind of walk me through the emotions that were going, every day when you had to go to work and see this individual and work with the person. Like, how did you feel?
So I'm an introvert. So it was pretty easy to just be quiet. I just go, I do what I have to do, and I get out, outside, this individual, literally, we lived in the same apartment complex. So she tried her best to become friends with me after the incident. And I just wouldn't. So I constantly had to deal with that, where it was just like, oh, come hang out, like, let's do all this stuff. And I'm just like, girl, you're evil. I'm I'm not hanging out with you. Like I'm traumatized because of you, like I don't know what you're going through, but I don't want to deal with that. Like, I've already had enough of that. I didn't want to deal with it. So no, I avoided her as much as I could. There were times when like I had ICU with her, and so, but at that point I was the second year, so I didn't have to like worry about whatever. And yeah, you will still see instances where she would try, if she's like deficient in something, she would kind of deflect and like ask you like, oh, don't you agree, type of thing. And I'm just like, quiet. I'm like, throw yourself under the bus, not me. Okay. Like, so I was just quiet through the whole thing. I suffered in silence, basically, is how I would put it. And yeah, that has its own consequences too. But I was lucky that she wasn't like obnoxious about it. She just constantly, she knew she did something wrong, and she was trying to fix it, and I wasn't having it.
Yeah. So would you say that by second year, like all the, the feelings you had, would you say you've healed from it, or did it you carry? Because some people carry this hurt and this, when there is so much negative being said about you, it's very easy to slip into that place of imposter syndrome. Should I really be doing this? Am I competent enough? Or, should someone else take my place at this point? Did you ever go through that feeling?
Yeah, absolutely. I mean, like, after I finished residency, I worked for a little bit and I realized that was not for me. And so I started my own practice, and that was difficult. Because I tell people I'm on a self-guided fellowship right now. So yeah, I had to constantly deal with imposter syndrome because what I was doing was not what I was trained in.
Yeah.
And sometimes, I could still recall like, the she's not good enough, like she needs to be better, she needs to work harder.
Yeah.
All of these things that were being said about me. Unfortunately, one of my attendings was talking about me. He didn't know that I heard him. And so like that really messed me up.
What did he say?
He was talking to another attending about me and saying I wasn't working hard enough, my work wasn't polished, like there was just a lot of things that he wanted me to do. He was in charge of deciding whether or not I would go on probation. And so when I heard him have that conversation, like I just lost it. So I was just like, oh my God, I've worked my whole life to become a doctor, and I didn't even know what remediation was or probation.
And now this dream is about to be taken.
No, it was not the end of the world. I just thought, if this happens to me, I'm not a doctor anymore.
Yeah.
And so at that point, I was suicidal. I'll be honest about that. And every single day, I had a plan and everything. Like, I was just like, my life is over.
Wow.
Everything I had done until this point was to become a doctor. And for this one girl to start something that literally I felt like destroyed my first, like my hopes and dreams.
Yeah.
Now, like, it was not even that big of a I didn't know that. I'm like this 26-year-old, medical school. I've like worked really hard to get here.
Yeah.
And then it's just going to be taken away. And so I almost lost it. Now, luckily for me, my car accident, the person who hit me, because it was a hit and run car accident. Yeah. So the insurance company, I just randomly got a check in the mail for the incident. I was like, okay, maybe I should just go on vacation. So that's what I did. My last month or my last 2 weeks of first year was vacation. So yeah, I took that money. I went to Europe, and part of my problem was that I was not sleeping, right? So amongst other things, I had sleep deprivation, so many different health issues that came about. So it wasn't all because of the bullying, but that first year, there was just a lot going on, like the not sleeping. I was in constant pain from the car accident. A lot of things were going on. And so like, it just felt like all at that one moment, everything was just like, I didn't see any exit. But then I did get an exit. I got some money and I was, broke resident, and like, I got like a big check. I'm like, okay, you know what? Let me just go somewhere and think this through. So that's what I did. I took a vacation. I slept. I ended up going to Belgium, and I slept on my cousin's couch for 18 hours straight.
Oh, wow.
Yeah. And then I woke up and I was like, oh, maybe I was just sleeping.
Well, I'm glad that, that things, even though the wreck was a bad thing, right? And so things happened and you got to come up for air, so to say. You got to breathe and you got to, actually, I can actually take in a deep breath. I can actually live life, because heaven forbid, if you had become a tragedy of medicine, right? Where, like I said, you were in that spot where you didn't see any way out. This is your lifelong dream. And it just looked like just someone's words were going to take it away from you. So that's a tough place to be. Now, in your program, were there people that you could have reached out to, like, to talk to say, like, did people know that this was going on with you and just kind of look at you with that sad, oh, I'm glad it's not me type face? Or was there some form of intervention? Because I'm thinking that at least someone should have seen something.
Yeah, no. I would have been one of those ones that everybody would be surprised about, because I'm always happy, I'm always smiling, and I'm the sufferer in silence. So I think that if something had happened, the only person who started to pay attention was my mom, because I don't know how she knew, but all of a sudden she was calling me 3 times a day. And she was just like, something's up with you. Like, I was very withdrawn and all of that. I did talk to like my assistant program director. Like, I tried to talk to her about what was happening, but she was just she just said, like, just, you'll get through it, like, and that wasn't good enough. Saying
it's one of those things.
We all go through it. She was also a person of color, so it wasn't like I felt like she didn't want to rock the boat. You know what I mean? So I was like, I'm not getting through it, and so it wasn't until after I came back from vacation and I had some health issues come up. Again, I truly believe it was due to all the stress, sleep deprivation. Like, my health really took a toll. It took a toll on my health. I ended up getting a physician who was part of the hospital group. And she was like, yeah, I was worried for you. So, and she told me she was worried for me because of what all the other physicians were saying, all the attendings, like, because when she had gone through the same residency program, she didn't feel like it was fair to, for people to be making that type of judgment about me. And so then I ended up seeing her. We had to do a lot of blood work. Like, I was going through some stuff. I think I had like a vitamin D of 6, ferritin of 9. Like, I was just, my body was going through a lot. And I ended up needing surgery because, again, I had so many things coming up with my health that I truly believe was all related to the stress of that year. And so she had she was able to see what was happening with me, right? And she was just like, yeah, like she didn't think it was fair. But no, it would have been a surprise. It would have been like, oh my God, we didn't know what happened. Like she didn't say anything because I
Yeah.
truly I just suffered in silence. There was really no clue. And so I can empathize with people who go through that, you know,
Yeah.
and people are always so surprised, like, oh my God, physicians, why would you want to do that? I'm like, you don't understand. If you've never been there and
Yeah.
been in that situation psychologically, you don't know.
No, you can't know. No.
You just don't know.
Oh, wow.
Yeah.
Like I said, I'm glad that you pulled through. So looking back, what would you have said you'd have done? I know you said that you learned to stand up for yourself.
Girl, listen. No, it's a full sentence now. I think so. Two things. One thing that I have learned is that, like you said, a lot of times people bully you or they don't treat you well because they're going through something. Okay, it's not about you.
Yeah.
It's about them and what they're going through. And is it fair that they put it on you? No. But if you go in with that notion that you just don't take things too personally,
Yeah. Yeah.
I took a lot personally. Like it felt like the whole world was against me.
Yeah.
They were going through their own stuff, you know.
Yeah.
Whatever decision was made, like part of it had to do with them. It wasn't
Yeah.
about me.
Yeah.
So that's one thing that I think is really important. And the second thing is you need to build your self-confidence.
Yeah.
You need to know who you are, and you need to make sure you don't let anybody else tell you who you are.
Sure.
Because, I mean, if I was very confident in who I was, I would not have taken crap from anybody.
Yeah.
Right. So I think the takeaway, and it's easy to say that, but like, you know, for me looking back, like everything that I did was to go to medical school. Like I studied really hard. I did medicine. I don't think that I really was able to take the time to get to know who I was because I was on this long 11-year path, right? And so it's easy for new residents to be lost in food, or to not even have a good self-concept. In a way, that part of our lives developed much later than the average person.
It did. I mean, the average person is out of college, right, and living life, making decisions. We're still thinking, learning. We're still at that, I got to know more. Like we don't feel confident enough to do things outside of medicine because that's kind of all we know.
Yes.
You know, so you come in as an intern, you're still looking for someone to define your life because yours isn't well defined. And then when you meet someone like a bully who tries to, you know, speak down to you, then you start to think that you are who they say you are.
Yep, you believe them.
Yes, and then your self-confidence, all that goes out of the window.
Yeah.
Yeah. Yeah. It's a tough place to be. It really is. As I said, when you feel like you don't have a voice, you know, and you're so scared, you know, you just came into work, you came in to finish, and then now it's like this sudden lifelong dream. It's just about to be taken from you. You know, it's a scary place to be. So, what do you now? I heard when you were talking about you know, that there was a lot of whispering going on around you, a lot of talking. So talking like, did any of these people who doubted your competency, did any of them ever come directly to you to say, hey, what's going on? Like, how are you struggling? How can we help you? Like,
no.
Why do you think that is? Like, sometimes that's it, because I've been in your shoes, I kind of understand. I understand totally. It's like, okay, if you feel I'm struggling here and you're supposed to be a teacher, supposed to be a mentor, you're supposed to develop me in this area when it comes to medicine. Okay, why is it a problem? Why can't you talk to me directly? Why can't you sit me down and say, okay, is this an area that I can help you? Or how can I help you here? Rather than just waiting for the individual to fail.
Okay, so I will say that, like, remember I told you about my assistant program director? I did reach out to her and she did try, but I think we spoke different languages. I mean, we speak English, but we spoke different languages, right? And so whenever she was trying to help me, because she had a few floor months with me, and,
Yeah.
we didn't have any issues. Whenever she was trying to correct me, it didn't apply to what everybody else was complaining about, if that
Yeah.
makes sense. You know how, like, if you're, when you're looking at, like, your core competencies, there's, like, different areas that
Yeah.
different
Yeah.
people have issues with. It almost seems like it's, like, a personality thing. Like, if this person feels like you're not competent in this and you improve it, then the next one is like, it's not this. Like, I never really felt like I knew what I was supposed to be doing,
Yeah.
you know?
Yeah.
Some, like, I had this one attending who was like, I just need to work harder. I'm like, the hell does that mean? Like, I barely sleep, right? Like, I'm studying my butt off. Like, I had all this stuff. So that was really difficult. And then another thing that came up, and this is something that I've had to accept now, is I feel like my attendings, some of them, I feel like they knew I had ADHD or ADD, but I didn't know. I was not diagnosed. And so I remember one of my attendings was like, because it asking me about like testing and like fatigue and all of that. And she was like, oh, maybe you should be on some Adderall. Like, it was just like in passing.
Yeah. Yeah. Yeah.
Like,
Yeah. Yeah.
and I was just like, no, like, I don't have ADHD. Like, I didn't know that I was dealing with this issue.
Yeah.
And so I feel like that was also part of it. That's why I said I don't think I was speaking the same language as everybody, because the way my brain works is not the way everybody's brain works. And I've had to learn that, for example, I can't handle stress. Like, it's just, and so I feel like that was an issue. Like, they just couldn't we just couldn't connect.
Yeah.
And honestly, I started performing when I stopped caring what anybody thought about me. And so what happened was, you know how, like, I had two residents who got pregnant my year. And so they were always taking time off.
Yeah.
And I would always volunteer to take their time, just because I'm like, they say I'm not doing well. Let me get remediation, right? Let me let me take advantage. And because I was sleeping properly during those months, because they tend to be elective months, I was performing. Like, I would go to the ED, I would do extra LPs, I would do paracentesis. I was doing everything because I was well rested.
Yeah.
But I noticed that all the months that I didn't do well was the months where I was not sleeping. I mean, I did okay in the ICU, but that was because I love the ICU. So that's another story. But like 4 months, like the hours were too long for me. These are all things that I'm understanding now.
About yourself. Yeah.
Out of it. Yeah. And so I think part of that was just I didn't connect with my attendings. So even if they were trying to give me correction, they didn't know how to give it to me in a way that worked for me.
Yeah.
So there was that. I feel like the other part of, because you had asked me like why people didn't want to say anything. I don't know. Like, I feel like a lot of people I feel like they were afraid to seem biased. Like, everybody worries about, oh my gosh, she's Black. What if I say this and she says she thinks it's racism? Like, you know what I mean? Just being real. Like, I got that sense a lot. And again, I need you to just be straight with me. I don't understand walking around stuff or like giving me things in parables. Like, I don't get it. Like, you just be straight with me. And so I felt like everybody was just tiptoeing around what they felt without giving me direct feedback.
Yeah.
And that was detrimental to me because I didn't understand what was happening.
It was. And so I can relate firsthand with that experience, with that. And I can give you a classic example. This is my first rotation, which was where I went through most of my trauma, like just the first month just going in. And I remember correctly, I had an attendant and I asked, I needed to know what to do right. Like, I knew I was struggling and I needed to know what to do right. So I go after the rounds and I'm like, okay, what can I do better? And what I got was, just get your notes in on time and I'll sign it. Okay, you're my attendant doctor. You're supposed to, you're the one supposed to teach me, right? I'll get your notes and I'll sign it. And then come evaluation time, I pick up my form and I look and it's like, she thinks like a student, does not think like a doctor. She needs to repeat this rotation. And
This is your first month. You are a student.
And I am baffled because I ask, okay, you're my tenure doctor, right? You're in this academic role on obligation to teach, to mentor, to direct, to guide. Because I'm coming in fresh, I'm coming new. I don't know my right from my left. You don't call me. I ask you. I come to you, and I ask you for feedback. I expect genuine and honest feedback. Like, no, you're doing really poorly. Like, you got to sit up. I would appreciate that better than trying to just dust it off. And then when it comes to writing it down, then you go write it. That's one thing today I cannot come in terms of. I believe, part of the reason with Physicians Keepers is, okay, if you're in an academic setting, you're supposed to train a doctor, right? Because you took that role because you want to train. Then train, make things open, make things plain. Because that
not every person who trains is a good teacher.
But how do we fix that? I think we need to have some form of guide for everyone who wants to go into training. Like, we need to have some, if they have to go through a training session, because like you said, you just coming first year, and then you're the second year, who you met, there was no manual for how should she talk to you. There was no guide to say, you can't say that to an intern, or this is what you need to do, or this is how, she just finds herself in second year, and then now she's just treating you the same way she was treated, because no one told her that that's not the right way to treat. So I think one of the ways that we need to seriously think about fixing is we need to have structures, especially in training programs, because thankfully, like I said, you made it through, right? But there are other doctors, I'm sure, who did not, who experienced some form of trauma through their training, through an individual, which was not a reflection of themselves, right? Environment, the fear, the anxiety, the depression, all that showed up, right? And then they got to that point where it's like, oh my God, I can't take it anymore. My dream is about to be over. I'd rather just be over first for this, So I'm hoping that that's something that we can seriously look into, to say, okay, we need to have more mentors. Like, we need to develop people that have more mentor mindsets than just occupying an academic role as a teacher.
I think that the problem is actually bigger than that, right? I think the problem is the whole training system altogether. Because think about it this way, I feel like a lot of the attendings couldn't be good mentors because they were going through their own stresses as well. You know what I mean? Like, if they have a bunch of, they have their attendings and they have their own practices and patients that they need to see, like, that in itself is not easy. So, like, if they're not at their best potential, they cannot actually give us their best, or they cannot actually pay attention to the little nuances or little things that they can actually give us good feedback about. So what happens when the time that they do pay attention, because, we're human beings, we pay attention to the negative things, and nobody pays attention to the positive. So now all they see is, oh, she made a mistake here, she made a mistake here, she must not be competent, right? They don't have the capability to see the whole picture. It could be because they don't have the time, or they don't want to, or they have their own notions about what you're supposed to do. And if you do it a different way, then, I had this old school professor. I loved him, but he was really old school, and he was my infectious disease attending, and he wanted things in a certain way, and it had to be in that way. And I'm like, my brain does not work that way, And so we would have this tug of war. And so there has to be also accommodation for different learning styles. And for me, my biggest thing is, if I had known that it would be like this, and I had the option to do internal medicine in 4 years, I would have taken that option. Seriously.
Yeah.
Because then I would have been able to sleep. Because I have learned I cannot perform if I don't sleep. Yes. And so I at first I didn't really pay attention. It wasn't until second year where I had to do ICU call. that all hell kind of broke loose. So I'm asthmatic, and most of my medications I take and they make me sleepy. So I need to sleep. Well, what happens when I'm on a call for 30 hours and I can't take those meds? So I don't take my meds so I could stay up for a call. And then luckily, my attending, because he's from pulmonary critical care, he started to notice like more asthma attacks and all of that. And so my physiology was not conducive to a 30-hour call.
Yeah.
Like I just couldn't do it, right?
Yeah.
It really compromised my health. And, we talked about it and we tried to figure out like what we could do to help me be in that position. And there wasn't really a solution. I just literally had to get through it. I had to just not take my meds on call nights. And then I would try to overcompensate. And that really messed me up, right?
Yeah.
So for me, I was like, well, I wish I had the option to not have an overnight call.
Yeah. Yeah.
Like as a person, I needed sleep to function.
Yeah.
Like the whole reason I went into medicine was because I have medical issues. So I identified, like I always wanted to help people the same way I was helped. I didn't know that wanting to do that was going to almost kill me.
Oh, wow.
Wow.
Yeah.
And so I feel like the way it's set up, it's not for everybody.
True.
And it doesn't mean that some people shouldn't go to medicine. It just means there should be options for different learning styles and for different people. Because, think of how many people we've lost.
Yeah.
Who could have been great physicians.
Absolutely.
Just because, they couldn't handle what was going on.
But I'm hoping now that we're talking about it and giving, some awareness to this, that things will change. Is my hope. I mean, pretty much while we're doing this, while we're lending our voice and we're speaking up, I'm hoping to see some change in it, and we'll see how it goes. But thank you so much, Dr. D, for sharing your story. I can't wait to get you back for the other things that we want to talk about.
Yes. Well, I want to end on one note. I want to say, if anybody is going to medical school, for example, and they're about to go to residency, like I feel like we should have some way of like having like mentorship, like outside of residency.
Absolutely.
Where like if something's going on, you have somebody's number that you can just call and be like, I'm going through this. Am I crazy? Or like, sometimes it just helps to have somebody who you can just talk to. People DM me all the time. So like people DM me on social. I'll give you my social. And I'm like really open to just talking people through, because I know I wish you had somebody like that, right? I just had to deal with this on my own. And so I think that especially for doctors who are of color, we have to go through so much. It would be helpful if we had some sort of mentorship or like a directory where you could just like phone a friend and be like, listen, I'm going through it. Help. Can I just borrow you for 1 hour? You know what I mean?
I totally agree with you, because like I said, when I was there, I felt so alone. I didn't know what to do, right? And then talking to someone in your program may not be the best thing to do, but then having just some outside voice that tells you, hey, it's okay. You're not crazy. You're going to go through, you're going to get through this. Like, it's going to be okay. This is not the end of the world, would be very helpful. Yeah. So could you please leave your details so anyone that wants to reach out to you, how can they get in touch with you?
Yeah. So Instagram, if you want to DM me, is the easiest way. So Degha Fongod MD is my handle, and I'll give it to you so you can put it in like the show
notes. I'll do that.
So that's like the easiest. I respond to all my DMs. I mean, most of them are potential patients. Because what I do aesthetics specifically for people of color. So that's like my specialty. So I get all kinds of DMs, and I'm usually the one responding to them. So just send me a DM if you need an hour to talk.
Thank you so much. I really appreciate it. And thank you for your time today. And I would definitely put your details in the show notes. And we'll be definitely talking later on in the future about other things. But I appreciate you, and thank you for sharing your story.
I can't wait. All right. Thank you for having me.
I hope you enjoyed today's episode. Please like, share, and subscribe and invite your fellow physician to come join this amazing physician community. See you next episode. Thank you.